Hello, Melamed community. So happy to be back with you again. I just want to make sure that you remember to like and subscribe, and we love engaging with you, so make comments if you will, and we will respond. I'm Dr. Norma Mobley, along with my friend Sharon Dixon.
And listen, we are excited to be here yet again. And
Yes.
I'm going to repeat that. Like and subscribe. We love the interaction with you. Hey, we are in the middle of this shutdown.
Correct.
And we want to talk a little bit about the Affordable Care Act and what it means in terms of this shutdown. Why are we in the shutdown? We really are here because of the subsidies in the ACA.
Right.
So we want to talk about it.
Because people don't know how to play well together.
Oh my gosh. Can we get that sandbox together? I tell you.
I mean, really.
And that's what it was supposed to be, right? It's supposed to be compromise and we all look at what's best for the people. So I just want to share with our guests just a little bit about what we're seeing. Right now, we know that 24 million people are at risk of losing their health care because of this.
Now, one thing I want to say, just in case we have viewers who are not well versed in medical terminology, let's just explain what is the ACA.
So the Affordable Care Act was created to help with those who are, what we say, in the middle. Mm-hmm. We have a set of folks who primarily get their insurance from their employer. Those are working folks who work for big corporations that give them that insurance. Now, the other group is those who are considered to be poor and qualify for Medicaid and Medicare.
Right.
But then there's that middle group who could be working for themselves or working for small businesses.
Correct.
It's not that these folks don't have jobs at all, but they don't have a way of affording insurance. And the Affordable Care Act was built just for that purpose.
And let me just say, I wish that when I was one of those in the middle, that we had the ACA available, because I was not, I was self-employed, right? Mm-hmm. And in order for me to have health coverage for my son and I had to pay out of pocket.
So you have to think about that. We are physicians talking about being in the middle. If you are trying to build a practice, you don't always have access to an insurer who will take care of your small business.
That's
you
right.
are a small business.
That's right. So I would have been considered underinsured as well as my child. And you and I both have a friend and colleague who went through that same thing and ended up having an accidental injury, landing her in the hospital. Remember that?
Absolutely. Trying to take care
Taking
of
care of
patients.
other people.
Right.
And we can't take care of ourselves. Hello, haven't we been there before?
But listen, I want to add a little bit more to this conversation of why are we in this shutdown.
I'm sorry, girl. I went off on a tangent.
No, it's fine. Because it really is impactful of what's happening. But we want our guests to understand.
Right.
Like, what is this about? It's about what we call the subsidies. The subsidies were created in 2021 to help still lower the cost, because we just weren't low enough for folks to be able to afford purchasing insurance that would take care of the majority of their needs.
Right.
The Affordable Care Act was a great start. It gave access to insurance for preventative care. Mm-hmm. You couldn't charge folks for having a pre-existing condition.
Correct.
But we always knew it was something we were going to have to build on.
Right.
So when COVID came, we knew that folks were going to have an even harder time. And there were subsidies added that the government would take care of to lower the cost a little bit more.
A little bit further. That's right.
But now we know that we still haven't gotten there. We still have folks who really need to have that insurance in place. And in fact, when those subsidies came, over 5 million more people became insured.
Correct.
And that, ladies and gentlemen, it is important, because when we're not insured, what happens?
People get sick, people die.
And people go to the emergency room.
More often.
They go to the hospital more often.
Right.
And who pays for that? The taxpayer.
Right. And so for many people in the community that say, well, the Medicare cuts, that doesn't bother me. Medicaid, we're not on Medicaid. That doesn't bother me. Oh, yes, it does. Because somebody's got to pay for it. Healthcare is not free, never has been. And so what happens is those of us who are in that group that Dr. Dixon spoke of earlier have to pay higher premiums for that health insurance
Right.
that they're used to having.
Right. And there are countries that have a one-payer system, but we're not one of those.
Right,
We have
we're
a
not.
more complex system. And so we're trying to make sure, I thought, that those who were working very hard, trying to make it, and certainly now we're seeing more folks enter into the entrepreneurial space, they need to have a capability of being insured for their health care needs. And the Affordable Care Act was doing that. But again, modifications were needed. The subsidies, the key point is the subsidies were going to go away in December of 2025. But the time to get your insurance is in November.
Correct.
Right now.
Right now.
And so that's why it became an issue, because the concern was to try to get a compromise in place before folks were starting to look at their new insurance, because now we're at the point that we're going to see what this means, which
Right.
is premiums being doubled.
To the
And
roof.
yeah, and when those premiums are doubled for the folks in that group, the expectation is that we're going to see people leave the system.
Correct. They won't be able to afford their health care anymore.
Exactly. So when they can't afford their health care, they're going to go what? Back to using the emergency room, back to showing up at the hospital, which will then impinge on those who are in the other brackets of using health care that may be from their employer, but we're going to start seeing those
Everybody's
go up.
premiums are going to go up. We're all going to pay for it. We all have representatives at the federal level that are supposed to be speaking on your behalf. So get in touch with your legislators. Get in touch with your senators. Make sure that they are in touch with you, your needs, and what's for your benefit.
And here's one of the facts that everybody needs to know, and I'm just going to read this because it's important. 78% of the public, including majorities of Democrats, Independents, and Republicans, and Make America Great Again supporters, all think Congress should extend the premium tax credits beyond 2025. So that's who our representatives are supposed to be listening to, is the people.
The people.
The people.
We, the people.
Right. So because we have this standoff, now we're here where other things are going to be impacted, like SNAP. We talked about that. A lot of other benefits are going to be impacted. But if we don't come to a compromise or come to a solution or understand that this is what the people want, it's easy. You just extend them because you have the majority of the people who want it.
That's
right.
right.
So why are we fighting it?
Right.
Why are we fighting?
And for those of you who maybe in the past felt like my voice, my vote, it doesn't matter, it most certainly does. Right now is not the time to vote, but right now is the time for your voice to be heard. So again, get in touch with your senators, your representatives, life, liberty, pursuit of happiness. How can you get that if you're not healthy?
Right. And we all have to be a part of the solution.
That's right.
So make that call.